This week's topic is ageism. Ageism is the process of systematic stereotyping and discrimination against individuals based on age. Institutional ageism is rampant in our society. You can see examples of institutional ageism by looking at higher federal poverty standards, job training typically that's only provided for young workers, state welfare funds that are reserved for children and adolescents, and a healthcare system that focuses on acute care rather than chronic conditions. There are a number of myths about aging, and I've chosen to talk about 5 common myths in this presentation. Number 1, the majority of older adults will become senile, have a defective memory, be disoriented, or demented during old age. Contrary to popular belief, dementia is not a normal part of aging or inevitable. Statistics will vary depending on the study, but most estimate that approximately 2 to 3% of older adults in their 70s experience some form of dementia, 5 to 10% of older adults in their 80s, and this may jump to between 20 and 30% of older adults in their 90s. These statistics include mild as well as severe forms of dementia. Research concerning not only the treatment but prevention of dementia is ongoing and promising. Myth number 2. Most older adults have no desire or capacity for sexual relations. In other words, most older adults are asexual. This is obviously false. Sexuality continues to be an important aspect of an older adult's life. People continue to be sexual beings and enjoy sexual relationships through late adulthood. For the minority of older adults who experience physical problems that may limit their sexual expression, treatments are available. It's also important to remember that sexuality is not just a biological function. Sexuality includes the expression of feelings and self in a variety of ways in an intimate relationship that encompasses many aspects of one's gender. Myth number 3. Most older adults have difficulty adapting to change, and they are set in their ways. Older adults are no more rigid than younger adults. This tends to be a relatively stable personality characteristic. Thus, individuals who are rigid and have difficulty adapting to change in young adulthood will probably have these same difficulties when they become older. Myth number 4. The majority of older adults say they are lonely. Loneliness is one of the great fears that people associate with old age. Yet over 2/3 of older adults report being rarely, if ever, lonely. This parallels the degree of loneliness experienced by young and middle adults. Finally, myth number 5. Older people tend to be more religious as they age and they deal with their own mortality. Actually, levels of religiosity tend to remain fairly stable across the lifespan. Older adults do tend to be more religious than younger adults in the United States. However, as a cohort, they have always been more religious, reflecting the time and culture with which they were raised. So the consequences of stereotyping elderly people and older adults are that elderly people are expected to be asexual, intellectually rigid, unproductive, forgetful, happy, enjoying retirement, invisible, passive, and uncomplaining. These are all stereotypes that we have about older people in our society. Responses to ageism. Elderly individuals commonly respond to ageism in 4 different ways: acceptance, denial, avoidance, and reform. When we talk about acceptance, we're talking about an elderly person who accepts the negative image and may act old, even though this may be out of keeping with their personality or previous habits. This may mean that they stop or reduce their social activities, they don't seek appropriate medical treatment, or they accept poverty. In essence, this internalization of negative image can result in the elderly person becoming prejudiced against him or herself, resulting in loss of self-esteem, self-hatred, shame, depression, and suicide even in extreme cases. The second stage might be denial. Denial of one's status as an elderly person can also have negative consequences. For example, lying about one's age may not seem significant, but it can further erode morale. Another example is an attempt to pass for a member of the dominant younger group by undergoing cosmetic surgery, having hair transplants, or using widely advertised anti-aging products. While these practices are widespread, the quest for eternal youth can become inappropriate and ultimately self-defeating for those who attempt to stop the natural aging process entirely. Avoidance of ageist attitudes may also take many forms. Examples include moving into age-segregated housing, self-imposed isolation, alcoholism, drug addiction, or suicide. Finally, the reform response is the antithesis of the avoidance response, in that the person recognizes the discrimination and attempts to eliminate it. This attempt may be an individual one or a collective one through membership in an advocacy group such as the powerful AARP, American Association of Retired Persons. Elder abuse is also an important topic to consider when we talk about ageism. We know that between 1 and 3 million Americans aged over 65 have been mistreated by a caregiver, and that only 1 out of 6 incidents of abuse is reported. At this time, only 21 states maintain an elder abuse registry, while all 50 states maintain a child abuse registry. And we know also that 5 million older Americans are victims of financial exploitation each year. We also see ageism in healthcare. We know that there's a lack of appropriate care for elderly. We know that 35% of physicians consider an increase in blood pressure to be a normal process of aging, and that 60% of adults over 65 do not receive recommended preventive health services such as mammograms, vaccines, and exams. And this is an example of institutional discrimination. We know that, for example, chemotherapy is underused in treating breast cancer patients over 65, even though it can improve survival, and that older patients are significantly underrepresented in clinical treatment trials. 40% of clinical trials excluded individuals over 75 from participating. Finally, a few years ago, in 2005, Congress eliminated all funding for geriatrics education and training, which had previously been funded at $31.5 million per year, shifting funding to children and youth. Ageism also exists in nursing homes. We know that 9 out of 10 nursing homes report being inadequately staffed, and that over half of the 17,000 nursing homes in the U.S. fail to meet minimum standards, but only 0.5, half of 1%, are cited and penalized for patterns of widespread problems that cause harm to residents and could shut them down. When we talk about emergency services, we see ageism as well. About 60% of Hurricane Katrina's victims were over age 60, and about 80% of the individuals who die of heat wave-related hyperthermia each year are over 50. We see ageism in the workplace. The 2004 U.S. Equal Employment Opportunity Commission ruled that employers can deny health benefits to retirees at age 65 without violating age discrimination laws. And we know that 63% of applicants to jobs say that they would leave dates off their resume to hide their age, and 18% say they might undergo cosmetic surgery. Finally, ageism in the media. Despite the fact that the elderly comprise 12.7% of the population, less than 2% of primetime television characters are age 65 or older. We also know that 11% of male characters on TV between 50 and 64 are categorized as old, versus 22% of female characters between the ages of 50 and 64, and only 1/3 of older characters on primetime TV are women. As you go through the week, I'd like you to pay attention to ageism in the media and see what examples you can find of ageism and discrimination in various media components throughout the week.